time flies by so fast that you won't even notice that you have actually been there for 12 hours. Hi guys, and welcome to my channel. My name is Stephanie. I am a BSN RN, and if you're new here, thank you so much for stopping by here. I would love it if you will consider liking by hitting the thumbs up button, sharing my video, and joining the family by subscribing. If this is your first time here, hi, hello, and welcome to my channel. In this video, I'm going to be explaining to you what working as a step-down unit float nurse in the ED looks like. The very first thing I want to clear off is the very different partitions that are in the ED. We have the very first section, which is kind of like the triage. The triage section is where patients come in, and the nurses there are very excellent in knowing that, okay, this patient needs immediate attention, this patient needs to just be monitored, and maybe this patient just needs for maybe the doctor to just come and see them and then they can just go home. So we have the triage section where the nurses they are actively dividing the patient, so to speak, to the different units in the ED. The next section is going to be the section where patients are being monitored. These are patients that they feel like they actively need hospital treatment, but then we just need to hold them there whilst giving them medications and waiting for them to get a bed on the other unit upstairs or in the hospital. And then we also have a section where the patients who are coming are kind of acute. Maybe patients are within the window for stroke-like symptoms to get like the TPA. Maybe patients are coming with respiratory depression, failure. Maybe patients are coming with like acute bleeding or something that needs immediate intervention, or maybe a patient needs some surgical intervention to save their life. So I have seen like 3 units in the ED, so I just wanted to make sure to explain this. There's going to be the triage section, there's going to be like the section where they're monitoring the patients, and then there's going to be like the section where the acute patients who come in, most of the times they are just wheeled directly to maybe the step down unit or to the ICU, depending on if they were intubated or not. The next thing I found on the ED is the way patient assignment is being given. From the two hospitals I've worked in at, when you come to the unit, especially when you come in as a float nurse, you go to the break room or to like the conference room. They don't actually have like the patient assignment on sheets of paper. Everybody's going to sit there and wait for the charge nurse. The charge nurse comes now and kind of divides the patient to the different nurses by just saying it aloud, like, okay, you nurse, you are taking this, so I know you're coming from step down, okay, you can kind of handle this sort of patient. Okay, you are ICU, okay, fine, you will monitor this sort of patient, or you would be in the section of the high acuity patient, and okay, you are our normal ER patient nurse, you are very conversant with triaging, you will go to the triage. So that is one thing about floating to the ED that I realized, that they don't have like the system of already dividing the patient. You have to go to a conference room, the charge nurse comes in, gives everybody's phone, and then verbally hands out the patient with the notion or with the understanding that you are from this unit, you are from this unit, and you should be adequate enough to handle this kind of patients. The thing I would want you to know about me floating to the ED is the type of patients that are in the ED. Like, you will see patients of all age groups with different variety of medical diagnoses. Again, some patients will be on low acuity, high acuity. Patients are coming in with strokes, bleeding. Patients are coming in with some are coming with COVID. Some are coming in with like they need preventive measures to be taken care, like C. diff, airborne diseases. You will see patients who will be scheduled for like maybe a procedure the next day. You will see patients who come in with like infectious states that they are already going into like a failure in their system due to the infection. You will see patients with change in mental status. You will see like a variety of patients. I remember a patient coming in with like active bleeding. So when the patient is in bed, the patient is fine and all of that, but once the patient stands up, there is like a pool of blood all over. So this patient was being scheduled for a procedure the next day, which was the reason why they were waiting for the patient to have a bed on another unit. so that the patient can go for that procedure. So yeah, you will see different types of patients. You will also see patients who are not as critical. Maybe they have to be, transferred to like the med-surg unit. Maybe they are just continuing their home medication just to keep up. Maybe they are checking their blood sugars and all of that. So yeah, those are the kind of patients that you will typically see in the ED. So it's going to vary from like low acuity to like high acuity, where they will be needing like TPA in a case of patients who come in with stroke. The next thing I want to say about the ED, which was a very rude shock to me, and it was just too funny to me, is the way the ED nurses give reports. I kid you not, it's just so funny. So I come from the step-down unit where kind of report is very detailed. I love giving detailed report, and I love it when people give me detailed report. I might not mind if the report is not so detailed. I love to go dig out the information that I need for certain patients. But it was a rude, I don't want to say rude awakening. It was just a fun thing to just hear how the ED nurses give reports. I'm talking about, they will just tell you, okay, so this is a typical report. This is the patient Jane Doe. Patient is 63 years old. The patient is a female. Patient came in for bleeding. Past history, patient has had a hysterectomy in the past. Patient takes these medications at home. The doctor has seen the patient. The doctor is recommending so and so procedure tomorrow, and that is it. And next, the first day I got that kind of a report, I was like, is she joking or something, or is she going to bring the remaining one later on? It was just, I felt like, so what have you told me? The way they give the report in the ED is just so straight to the point. Like, it just feels like they've just told you almost nothing about the patient. It's like they just tell you why the patient is there, who the patient is, how old, their past medical history, maybe their allergies, and maybe the plan of what they need to do. I know that is typical of the ED, and I understand that it makes sense to give that kind of, a report. But coming from where I'm coming from as a step-down unit, the very first time I got that kind of report, I was like, she is surely joking. So just be very aware that the report in the ED is very short, very straight to the point, and that is because the patients, so to speak, are just passing by. So it doesn't make sense to like know everything about the patient, because most of the times the patient will just be with you for like maybe an hour, and before you know it, they're sending the patient upstairs, or maybe they'll be switching with you and another nurse just because they want to give you a more critical patient, or they want to give you a lesser patient, or just make another nurse's job lighter. So be very mindful of the fact that if you're someone who loves and craves and lives and dies by detailed reports, be very open-minded to the fact that the sort of reports that you're going to get on patients in the ED, if you're not careful, you probably will be saying some words that you wouldn't like to say to some nurses. Just come with an open mind that, hey, you will have to be digging up some things that you feel are important to you by yourself. The next thing about the ED is the task that you'll be doing with these patients. I feel like most of the patients here are more so just receiving their scheduled medications, their home medications. You're doing lab draws just to make sure that their numbers are within normal limits. You are also actively looking to see if maybe a bed has opened for them to be transferred. So it feels like you're just nursing the patients, or you're just babysitting the patients in the ED while they are while you are actively waiting for them to be moved to their, to their permanent unit or permanent room, so to speak. The next thing about the ED, which I hate so much, but I do understand that it's part of the job, is the moving of these patients. Again, you know that when patients come to the hospital, the first point of contact between the hospital and the patient is in the ED. And so it only makes sense that when the patients come to the ED, after the first, checkup, labs, medications, if they feel like the patient really needs, to be actively monitored and giving in-depth patient care, then we would have to transfer them to maybe another more high acuity unit where they'll be taken care of. And so this is a unit where you'll be moving patients like crazy. I do understand that sometimes the CNAs or the patient care, the PCAs, are going to be of huge help. Sometimes there's going to be what they call transporters in some hospitals who you can call and tell them, hey, this patient is being moved to this unit, to this room, to this bed, and they can help you move the patient. But in cases where the techs or the transporter are actively busy somewhere else, you would actually be the nurse to kind of ship your patient to where they have been assigned or transferred to. So there's going to be so many moving and transferring, especially if there are available beds. So just be open-minded to the fact that you're going to be pushing beds, you're going to be getting into elevators, you're going to be shifting and actively using your muscles, just being a chauffeur to the patients in the hospital building. The next thing I would want you to be mindful of the fact on the ED unit is that you would be, they'll be switching your patients back and forth, because maybe a new patient came in and they think that they want to give it to this nurse. Once they give it to this nurse, this nurse actually has heavier load patients, maybe they should switch it and give it to this other nurse who is not drowning. So be very open-minded to the fact that they will be switching patients between nurses. Be mindful of the fact that patients will come and for some reason they say that the patients don't really need hospital care, they are going to be discharged, and so they might take one of your patients and give to another nurse just to make the patient load even. You'll be mindful of the fact that things just keep changing, things are not stagnant. I can tell you that you can start with 3 patients at the beginning of the shift, and before you know it, you have taken care, let's say from 7 p.m. by 11 you had 3 patients, 1 more patient is going to be added to you, and then by 2 a.m. a bed opens up, you have to transfer 1 patient, you are now left with 3, and then another bed opens up, you now have to transfer your second patient out, you are now left with 2, but then another nurse has 5 patients, they will transfer that patient to you just to balance things up. Now you have 3, all other nurses are having 4, so to make things even, when the next patient that comes in and they feel like the patient needs to stay in the ED for monitoring, you should be open to the fact that you will be assigned that patient. So it kind of makes sense not to know so much about this patient, because it feels like the patients are just rotating through you, they're just passing through your hands. And I have had cases where I have come to the unit and took report on a patient, and before I could even give patient medication, it was time for the patient to move to a different unit, meaning I didn't give them the 9 p.m. medication. The nurse on the other unit had to be the one to take care of those medications. Sometimes I will go ahead and just give the patient the medication, or sometimes I will just, when you're giving a report, you will just explain to the nurse that, hey, I had other things doing and I haven't given them the 9 o'clock medication. Some nurses will understand, some nurses will not. So yeah, that is something you should be very open-minded when it comes to being floated to the ED, because if you've never been there, tell you the day you are going there, be very open-minded. Again, I would say that to all these points that I've brought up, your patients will just be passing through your hands. You don't need to worry about in-depth report. Just focus on the basic tasks to do for the patient, unless if something changes, give them their medication, empty Foley, keep giving them their fluid, their IV medications and all of that. If they need their pain medicine, if they need snacks, food, whatever, just keep giving it to them. Be open to the fact that you guys will be switching patients back and forth. Be open to the fact that you will be, you'll be chauffeuring patients from one unit to the other. Sometimes you would have to be the one to take your own lab draw. Sometimes there will be phlebotomists who actually do that. So yeah, there's just going to be a lot of things that you would have to be open-minded to be like, hey, I know this is all within the scope of practice of a nurse, and so just know that things are done differently in the ED. And I do understand sometimes it's fast-paced, but again, because I'm a night shift nurse, it's kind of slow, but it doesn't mean that things don't go very fast. And the beauty about the ED that I have noticed is that time flies by so fast that before you know it, it's already, the next shift nurses are already coming to the unit and you're like, oh, it's already time. Yeah, that is one thing about being floated to the ED that I love so much. is that time flies by so fast that you won't even notice that you have actually been there for 12 hours. Thank you so much for staying right up to the end of this video. I do hope that if for any reason you get floated to the ED, you're going to use this point and have an open mind. And if you like the video, please consider liking, sharing, and subscribing. And from me to you, I want to say stay blessed, and I'll see you in my next one. Bye guys.